Hello friends, welcome to Creative Medicine. In this lecture, we will learn about
treatment of hepatoblastoma. So here we have treatment of hepatoblastoma. Now, so in the treatment of hepatoblastoma, so the main treatment is to confirm the diagnosis and initial biopsy is required. So in order to confirm the diagnosis, initial biopsy is required in hepatoblastoma. Then for unresectable tumors, we should do a diagnostic biopsy is done for unresectable tumors. If the tumors are not resectable, then initially we will do a diagnostic biopsy is done, followed by placement of vascular assist device is also placed for the chemotherapy, because these are not resectable. So you should do a diagnostic biopsy and put a vascular access device for chemotherapy. Then followed by a second laparotomy is performed in these patients. After putting a device for chemotherapy, you will do a second laparotomy. Then after laparotomy, you will give Actually, first you will do a diagnostic biopsy and then you place a vascular access device for chemotherapy. Because you have placed vascular access device for chemotherapy, you do 4 cycles of chemotherapy and then you will do a second laparotomy also. When do you do the second laparotomy? This second laparotomy is done after chemotherapy. Actually, you will do the imaging studies again. And if you find that the imaging studies which were done have good response, if the imaging studies have shown good response, 4 cycles of chemotherapy are done. If the imaging studies have shown good response and also if the tumor is resectable, if the imaging studies have shown good response and if you find out that the tumor is resectable, in such case we can do a second laparotomy is done. So if you see the algorithm, first you do a diagnostic biopsy, then you place a vascular assisted devices, and then you do a 4 cycles of chemotherapy. Then you do an imaging studies are seen, and if the imaging studies shows good response and tumor is resectable, then you do a second laparotomy and then you will resect it. Okay, this is one thing. Then second, you can also do a neoadjuvant chemotherapy can be done, followed by resection can be done. Normally if the tumor is resectable, then you can do a neoadjuvant chemotherapy and resection. This is done if tumor is resectable. Okay, if tumor is resectable, we do a neoadjuvant chemotherapy and we resect the tumor. Now in this hepatoblastoma, 50% of patients will have pulmonary metastasis can occur in hepatoblastoma. Among the pulmonary metastasis, almost 50% of patients with pulmonary metastasis, these are actually treated with resection of the hepatic tumor. Here you will have to, in 50% of patients with pulmonary metastasis, you should do the resection of the hepatic tumor, followed by chemotherapy should be done, or we can also do the resection of pulmonary metastasis. So first and foremost, you should resect the hepatic tumor, followed by chemotherapy and resection of pulmonary metastasis is done. Then prognosis of hepatoblastoma. Prognosis is this hepatoblastoma survival depends upon the complete resection. If there is complete resection, then the long-term survival rate is seen in 60 to 70% of the cases. After complete resection, long-term survival is seen in 60 to 70% of the cases.
thank you and thank you for watching.